Certainly, the scene inside our hospitals has shifted significantly. You have far fewer patients, primarily in the hospital due to COVID, than what we saw during our peaks. Also, though, for the first time since widespread vaccinations, there are about the same number of vaccinated and unvaccinated COVID patients in our state. Anusha Roy has some context on that.
We watch these numbers routinely, so it caught our attention when Wednesday there were 42 vaccinated hospitalized patients and 46 unvaccinated patients, a near even split. And then today, there are more vaccinated patients than unvaccinated, 57% to 43. There are a few reasons, though, that experts are not surprised.
With Omicron, many of those who were unvaccinated became infected and now have naturally acquired immunity. So the pool of people unvaccinated is now increasingly immune, of course, because they have had Omicron infection or perhaps Delta before that. And so we see a change in the proportions. So this is what we would expect.
Dr. John Samet with the Colorado School of Public Health says it's not a reflection on vaccine efficacy.
The vaccines are working because we have far fewer cases and far fewer people.
Well, you have to look who's in the hospital beyond who's vaccinated. I mean, do they have other conditions? Are they elderly? Do they have diabetes? Are they obese? Do they have kidney disease? I mean, there are a lot of factors to go in to who gets, and if they're immunosuppressed.
Apply that same thought process to these data sets. The state health department says it doesn't reflect a number of factors. Older people, even with vaccines, are also more likely to be hospitalized. And with near 80% of adults in the state considered fully vaccinated by the state, it's a much bigger group of people than those without the vaccine. So by sheer numbers, there can be more vaccinated hospitalizations. But when you break it down by age, a more apples to apples comparison, people without their shots end up in the hospital at a higher rate.
We don't know how long the natural immunity will last. The preliminary data is very clear that receiving a vaccine gives you a higher level of immunity than the natural infection.
So what is still being researched in both cases, right? Either you have vaccines or with natural immunity, is how long does that protection actually last? And it's really important to remember here that people are also being hospitalized right now for other reasons, and then they find out they have COVID. And so that's kind of a texture to this whole thing to keep in mind.
And I feel like that, Anusha, was one of the lessons that we learned along the way between the what is happening, the pure numbers, and the why is it happening. Like when we realized with the less serious variants that there were a lot of people who just had COVID that were in the hospital for something else. This is another thing that just needs a bit more context.
Yeah, exactly. You know, when you look at CDPHE's website, their dashboard, right, hospitalizations have been such a huge factor here. But if you just take that main page just at surface level, it doesn't really tell you the full story, right? So you actually have to dig around on the website and then figure out how to piece all of that together to fully understand, you know, what is happening in our state.
Or get yourself an Anusha. That's another thing that people can do.
That's why I'm here.
You do it for us. Thank you, Anusha.